Allure, Glamour, and Self magazines, Bravo, CNN, Fox News, and MSNBC have all focused their attention on our featured speaker. He's the author of Reverse Your Diabetes, Change Your Life, and Secrets to Weight Loss Success. Please welcome Dr. Stephen Wander.
Good morning. Good morning.
Good morning.
Buenos dias. My name is Dr. Stephen Wander, not like the singer, Stevie Wonder. I can't sing. I first want to thank Harvard Faculty Club for inviting me here to talk about my mission of reversal of type 2 diabetes. Chances are some of you in the audience know at least one person in your life suffering from this horrible yet 100% completely reversible disease. By a show of hands, who knows someone? Thank you. Now, when I was a teenager, I was out to lunch with my grandparents, Sonia and Aaron, and they're from Brooklyn. And being from Brooklyn, some of the 3- and 4-letter words that make movies R-rated, for them were just commas. First thing my grandmother did, she laid out 13 pills. And I said, what are all those pills for? And she said, well, the first 2 are for my diabetes. The third one's for my thyroid, the 4th one's for my cholesterol, the 5th and 6th one are for my high blood pressure. The 7th one's for the side effects of the first one, the 8th one's for the side effects of the second one, and so on. Now, my grandfather certainly didn't go to Harvard and wasn't a formally educated man, but he always taught us that if you can't make it make common sense, it can't be true. So when I looked at those 13 pills, I knew something wasn't right. And from that lunch, I saw my grandmother go downhill from oral med after oral med, onto insulin, dialysis, until eventually I went to the hospital to visit her one day, and she gave me one of these, and I looked down at her, she looked me in the eye, and she said, Stevie, I'm done. And I didn't know what that meant until 2 months later, but everybody figured it out 2 months later when my grandmother passed. A young woman, a shell of her former self. Now, my grandfather's still alive. He's 96. Now, remember, he's from Brooklyn, so when I told him today I was speaking at Harvard, his response was, I guess the standards are getting a little bit lower up there. They'll let anybody in there now. But that led and leads me to today, my mission of reversal of type 2 diabetes based on my grandmother's experience. Now, I've been seeing patients since the 90s, and unfortunately, the diabetic story hasn't changed. Typical patient goes in, they get diagnosed, they do some blood work, they get a call from the office 2 days later. It says, Mr. and Mrs. Jones, your blood work's in, the doctor wants to see you. And they can tell by the tone of the voice on the other end of the line, something's not quite right. So eventually they go in, they wait about an hour and a half for their doctor, but eventually the doctor comes in, and he comes in, he says, Mrs. Jones, I'm sorry to inform you, you're a type 2 diabetic. And my patients tell me before the word diabetic is out of his mouth, the doctor's clicking his ink pen, putting out his script, and says, here, take this. And this is a drug that begins with M, ends with N, and sounds a lot like what? Metformin. And in a group full of diabetics, when I'm in a room speaking in front of them, they all shout it out in unison. How can they all be on the same medication? And are they type 2 diabetic because they have a decreased amount of metformin in their system? And then ask yourself, how long are they supposed to take this medication? And then the doctor gives them this great piece of advice. Change your diet, lose weight, exercise. And unfortunately, in the pill for an ill model, that's how they're counseled for the rest of their life. So every 3 to 6 months, when the blood sugars start to creep up, they go into their doctor, and the doctor says, well, numbers are getting higher, it's time for a change. What's a change mean? A change means more medicine and or an additional medicine. And with diabetes, it goes metformin, then they go on to glyburide, gomipiride, glipizide. When that doesn't work, then they move over to Actos and Januvia. When that doesn't work, it goes to Farxiga, Invokana, Jardiance. When that doesn't work, it's going to be the one you see when football season starts on TV. Eventually, when there's no more oral meds, they're going to go on to insulin. And we know that insulin decreases the lifespan 10 to 12 years. So by treating the symptoms, which is the high blood sugar, versus the cause, leads these patients down horrific complications. Heart attack, stroke, liver failure, kidney failure, amputation, peripheral neuropathy, blindness. And by treating the symptoms and not the cause, has led diabetes to be the 7th leading cause of death to it's now the 3rd leading cause of death. And it's underreported based on the statistics from the American Diabetic Association. So if that pill for an ill model is not working, what can you do? How can you possibly reverse diabetes? Well, I know it sounds crazy, but you must find out individually what is not working for this person. How do you do that? Testing. What kind of testing? Very comprehensive testing. Fatty liver, leaky gut, yeast, candida, food sensitivities, adrenal fatigue, overfunction of the thyroid, underfunction of the thyroid, autoimmune issues. And I want you to know there's actually 4 types of diabetes. There's type 1 and 2. There's type 1.5, which means the person has an autoimmune aspect. And then there's type 3, which means Alzheimer's. But when you find the right patient by testing them and customize an individualized program for them, you can reverse the disease. And actually, it's quite easy. And what happens when you reverse the disease? Reduce and eliminate the need for medication across the board, not just their blood sugar medication, their cholesterol medication, their blood pressure medication. Lose weight without exercise. What's that, a sex drive? Sleep through the night, get rid of the brain fog. And there's only one thing I want you to remember, that type 2 diabetes is preventable, treatable, and reversible. And when we pick the right patient for our program, we rarely see a patient fail. Thank you.